Good morning, everyone. This is the second video of my kind of a newish channel. Um, Today's subject I want to talk about is should chaplains be board certified? I understand this is kind of a touchy issue for some people, uh, but but just to get straight in the video, my answers is should chaplains be board certified? Is yes and no. Um, I'm gonna get to both of those, and I'm gonna explain to you the kind of the bodies you can look at because there's like many options out there. Um, but first, I'm gonna say chaplains should not be board certified, and the reason why I believe chaplains should not be board certified is because no one really cares. Anyone outside of a chaplain department really don't care if their chaplains are board certified. You go in the patient's rooms, their homes, and they don't know what a board certified chaplain is. They don't really care. The staff you work with every day don't care if you're board certified. Um, and I'm convinced that that whoever makes up these hiring qualifications, the HR department, if it's not a non-chaplain department, if it's like a general HR department, will list you have to be certified in this amount of time through this organization. They don't know what that organization is, and they don't know what a board certified chaplain is. So, short answer is chaplains should not be board certified because no one really knows and cares outside of a chaplain department what a board certified chaplain is. I do believe that chaplains should be certified. Um, Here's my yes answer because if you work in a healthcare setting, you have all these disciplines like nurses, aides, doctors, and even social workers that has to have some kind of license, have to be certified. So if all these other disciplines have to get certified, why not chaplains? Just to make it an issue of fairness. So that is really my gist of it. If you have any questions, concerns, want to anything like that, don't feel free to comment. But I am going to move into like certifying bodies. There are two major ones. There is a spiritual care association, and then there is Association of Professional Chaplains, which is APC, Spiritual Care Association, SCA. I'm going to give you kind of the rundown of the APC because that's the one I'm most familiar with. Um, the APC is it's like the big one, and if you want to get a job at like a large health system, then you have to go through probably get certified through the APC. They require their chaplains to. But let me back up. If you come in with a certifying body outside of the APC, let's say you're certified in a spiritual care association, they could hire you, but they could make you go get certified get certified in the APC, and they will not take your certification very seriously. Uh, my my drawbacks to getting certified through the APC is number one, if you work in a I work in a hospice setting in a very rural area. I feel like the APC is built for chaplains practicing in a major hospital in a very urban area. They made a new rubric. They made a new rubric to kind of address some of those. I feel like to kind of address They want to have more chaplains certified through them, through through the besides the hospital system. So they made a new rubric to kind of, it's kind of hard to explain, to kind of the kind of include other chaplains in other settings besides hospitals. That is, I think it needs more work. I think they're almost there. But if you come in not in a hospital setting and not in a major urban area, you may be at a little bit of a disadvantage on some of these competencies, because some of these competencies don't will not apply to you. I'm familiar. There's like many smaller ones. There's like the CPEI, Clinical Pastoral Education International, a World Spiritual Health Organization. There is, I think it's the Association of Credentialed Christian Chaplains, which is now recognized by VA Health System as a legit certifying body, and of course there's the Spiritual Care Association. So like me, my job is not requiring me to get certified. Um, so I'm looking at the APC, but I'm also looking at one of these other certified bodies. Um, I'm doing my research and I'm comparing contrast, and and to see which body I want to go with. If I want to go to, if I can see myself working in a jumping to hospital chaplaincy in a few years, I'm gonna go with ABC. But if I'm satisfied with my hospital job like I am now, I'm probably going to just check out one of these other bodies. Um, so if you want to get certified, your healthcare system, whether you're working in a smaller hospital, whether you're working in hospice or another setting, if they don't require you to get board certified, you have to ask yourself why you want to get board certified. And well, first of all, you have to ask yourself if you really want to go through this process, because some of these processes can be very, very long. Um, I know some of them can take up to 4 to 6 months. So if you work at a healthcare setting or another kind of setting, and they don't require their chaplains to be board certified, you have to ask yourself, do you really want to subjugate yourself to that kind of work? And and if you do, you have to ask yourself, why do I want to get board certified? And if you decide to get board certified, and your job doesn't require it, or they really don't care about who you go through, sure, check out the ABC, but will it really hurt to check out some of these other certifying organizations? Um, the the kind of do your research and find which one fits better with your setting and which one fits better with you. So like I said, if you have any questions, concerns, pushbacks, just let me know in the comments, and hope you all have a blessed day, and and just go out there and do your thing. Bye bye.